Hello, my name is Dr. Aditya Kapoor. I am the Director of Orthopedics and a Senior Consultant Orthopedic Surgeon at Omega Hospitals, Gachibowli. I was trained extensively with undergraduation in Manipal. I did my post-graduation in orthopedics from Pondicherry, and I was in England for about 7 years working for the NHS. I did my senior fellowship in joint replacements and lower limb arthroscopy in the UK, as well as the senior fellowship with Depuy Johnson & Johnson in joint replacements including revisions. I have done the Arthrex fellowship for shoulder surgery and sports medicine. I have been practicing for over 2 decades, and during this period I have performed thousands of joint replacements including revisions, partial knee replacements, a lot of cutting edge arthroscopy, sports medicine, and I'm very passionate about cell therapy and osteoporosis. So we will be talking about each of these. I have been performing joint replacement successfully and was responsible for introducing the opulent knee with vitamin E poly back in 2018 in South India. I have also received the Young Achievers Award for Orthopedics by Times Healthcare and was amongst the first to perform cell therapy for avascular necrosis of the shoulder in the 2 Telugu states successfully. I perform knee replacements including revisions and partial knee replacements. My patients recover very quickly because what we do is called as a fast track knee replacement, and I have been doing this for over a decade. This includes a minimal incision, a muscle sparing approach, as well as extremely accurate balancing and alignment of the knee, followed by superior pain control, which is how our patients get discharged in a very short time and go back to a normal life, including squatting and sitting on the floor. I'm also trained and have performed revision joint replacements very successfully, and I have been using extremely cutting edge equipment, for example metaphyseal sleeves for revisions. We also do osteotomies of the knee, what is called as joint preservation. This happens to be something that I have been performing for over a decade now successfully. The challenge we face in our country is with younger people developing arthritis early. A lot of the times this is unrecognized, and we have successfully saved people from having a joint replacement by combining cell therapy, where we inject autologous plasma for people who have got generalized early arthritis, and for people who have got a mechanical malalignment, we then perform a high tibial osteotomy. I do perform hip replacements including revisions, including ceramic bearing surfaces, and have been doing this successfully for over a decade in Hyderabad. I have specialized in lower limb arthroscopy. With regards to knee arthroscopy, I have successfully performed all inside ACL reconstructions, introducing them to Hyderabad as far back as 2012 and 2013. I perform every ligament reconstruction of the knee and sometimes combine it with high tibial osteotomy for patients in whom we need to save the knee. We do revision ACLs, PCLs, meniscal repairs, and where necessary, we tend to use cell therapy to restore the cartilage. We have successfully saved numerous joints from arthroplasty successfully with this technique. As far as cell therapy is concerned, I have a lot of interest in this and have been doing this for almost a decade. Where we tend to see early arthritis, we tend to give patients injections of autologous conditioned plasma. Where we see that there are focal cartilage defects, then we tend to regenerate the cartilage, including in athletes, using cell therapy either with bone marrow or with cultured chondroblasts. I have a lot of interest with regards to fracture surgery and have been regularly performing fracture surgery, including complex fracture management. We also tend to do osteoporosis management when we see people who have hip fractures and combine it so that they don't tend to get further fragility fractures. We have employed innovative techniques for hip surgery over a decade now, where we find that we were starting to see a lot of people with failed fracture fixation of the hips. For these people, what we have done is we now tend to employ a proximal hip replacement using what is called as a distal femoral replacing stem. This tends to prevent implants from cutting out and failing, and in those with osteoporosis, we have an extremely successful track record of preventing revision surgery such as so. I have successfully set up and run departments of orthopedics in leading corporate hospitals. At Omega Hospitals Gachibowli, over the past 6 months, we have performed numerous joint replacements, numerous arthroscopies, and complex fracture surgery, including non-unions. We have cutting-edge equipment over here. For sports medicine, we have the 4K camera system, which helps us achieve extremely good precision with clarity. We have laminar flow OTs, including extremely cutting-edge infrastructure, and all the equipment that we have, including for joint replacement, happens to be the latest and the best. We tend to replace joints with a fast-track protocol and with minimal incisions, with minimal discomfort, and with minimal stay. What we have achieved at Omega is to combine the latest technology, the latest in terms of the latest techniques with evidence-based ethical practice. This has helped us with providing superior care to our patients. It is my endeavor to provide the best in orthopedics, including joint replacement, arthroscopy and sports medicine, as well as fracture surgery and osteoporosis care. Thank you.